People often assume addiction treatment fixes everything. They assume the substances cause the behavior. They assume sobriety removes the harm. They assume couples therapy can repair the relationship. These assumptions lead people into dangerous situations because addiction and abuse are not interchangeable. They can overlap, they can feed each other, they can mask each other, they can also occur independently. The difference matters because treatment paths are not the same. Welcome. If you're new here, I'm Bonnie Adams, a licensed therapist who specializes in helping people recover from addiction and abusive relationships. This, as with all my episodes, is not medical advice. If you are in need of immediate assistance, please reach out to the National Domestic Violence Hotline or emergency services near you. This episode looks at the difference in real terms, what addiction treatment addresses, what it doesn't, what abuse treatment requires, what it demands, and where couples therapy creates harm when coercive control is part of the relationship. John and Julie Gottman describe addiction as an uninvited guest in the relationship. Their work frames addiction as something that enters the dynamic and disrupts it. They teach that couples work is possibly only after sobriety is stable and only when safety is clear. Their trainings emphasize careful triage. They teach that stability, consent, and emotional safety must be solid before any relational work begins. Now, this framing matters because it acknowledges that addiction can create chaos without automatically creating control. Abuse follows a very different structure. Coercive control is not an uninvited guest. It is not a symptom. It is a pattern of decision making. It is deliberate. It shapes the entire relationship. It dictates how each person moves, thinks, and adapts. Recovery does not undo the pattern. Sobriety does not remove entitlement. And therapy does not rewire it unless accountability is direct, consistent, and ongoing. Research on intimate partner violence treatment makes this clear. Studies show that treating substance use without addressing coercive control leaves victims at high risk. Reviews of intimate partner violence programs report that abusive behavior continues even when the person stops using substances. Alcohol and drugs may intensify abuse, but they do not cause the underlying need for domination. Removing the substance removes the accelerant. It does not remove the fire. Couples therapy becomes unsafe in these situations. The dynamic inside session mirrors the dynamic at home. The abusive partner controls the narrative. They charm the therapist, they correct the victim, they deflect accountability, and they use therapy language as a shield. They'll frame their partner as reactive or unreasonable, and then turn disclosures into weapons later. Trauma-informed clinicians talk about the red flags. They describe the partner who interrupts constantly, the partner who answers questions directed at the victim, the partner who watches every word their partner says, the partner who becomes angry when the therapist meets with each person separately, the partner who pushes to work on communication while refusing to acknowledge the power imbalance. These signs don't point to addiction needing treatment. They point to a pattern of control that must be addressed with accountability-based intervention. Now, addiction treatment follows a very different path. It focuses on the relationship with the substance. It focuses on relapse patterns, shame cycles, triggers, nervous system responses, family history. The goal is stabilization, insight, skill building, repair. The person learns how to live without the substance. Abuse treatment focuses on the relationship with power. It focuses on entitlement, justification, minimization, manipulation, emotional exploitation. The person learns how to take responsibility for the harm they caused. They learn how to stop controlling another person. They learn how to tolerate equality. These skills do not appear through sobriety alone. They require direct, focused work. The intersection of addiction and abuse creates confusion for families and clinicians. The person might show remorse when sober and become volatile when using. They might blame substances to avoid accountability. They might present as cooperative in treatment while controlling their partner outside of it. The partner might hope sobriety will fix everything. They might cling to brief windows of calm, and they might believe the abusive behavior comes only from intoxication. This confusion delays safety planning, boundaries, and clarity. Post-separation brings the truth into sharper focus. The partner in recovery might work hard on sobriety while still engaging in coercive control. They might fight for custody as a way to maintain access and use treatment attendance as proof of change while continuing emotional pressure, monitoring, or harassment. Clinicians familiar with intimate partner violence warn that this pattern is common. Removing the substance exposes the underlying structure, not the other way around. This episode sits with that distinction. Addiction therapy treats addiction. It does not treat control. Abuse treatment targets control. It does not treat addiction. And when both occur, each requires its own framework. Each needs its own language, and each demands its own safeguards. The takeaway is simple and not simple. Entering couples therapy with active coercive control places the victim at risk. Entering addiction treatment without acknowledging abuse leaves the victim exposed. Healing starts with clarity. Clarity about roles, clarity about patterns, safety, and about what treatment can and cannot repair. I hope that this episode brings some clarity forward. I hope that it differentiates survival from relational repair and highlights how accountability and sobriety move on parallel tracks, not a shared one. I hope that it names places where therapy helps and the places where it becomes another tool in the abuser's hands. I hope it grounds the work in research and clinical practice because you deserve accuracy, not false hope.